Let's talk about vestibular neuritis. My name is Amy. I'm a vestibular physical therapist, which means I treat dizziness and balance problems, and I created this TikTok page to set out and educate people about vestibular conditions. Vestibular neuritis is thought to be inflammation that is severe around the vestibular nerve. The vestibular nerve is the nerve that sends information between the inner ear, your body's motion sensor, and your brain. Now, the inflammation is not always caused by one particular thing, but usually, most commonly, it is from a viral infection. You can kind of think of it as your ear had the flu. Prevalence for vestibular neuritis is about 3.5 out of 100,000 people, or about 7% of dizziness cases. Each bout of vestibular neuritis between people differs extremely because it depends on the extent and the length of the infection. Typically, vestibular neuritis can be resolved. However, there are some cases that people are left with chronic dizziness symptoms from permanent injuries. There's typically 3 phases of vestibular neuritis recovery. The first is the acute phase, and it lasts anywhere between 2 and 7 days. It is a sudden and severe onset of imbalance, vertiginous spinning sensations, and nausea and vomiting. Phase 2 is the subacute phase and usually lasts for a few weeks, and usually it's the same symptoms, only a lot less severe, and the person is able to function a little bit better. Phase 3 is the chronic phase, and that's usually where most people are back to normal, but they may be a little extra cautious about movement or exposing themselves to things that made them dizzy whenever they were in the subacute or the acute phases. Symptoms of vestibular neuritis usually varies a lot between people, but usually involves dizziness, vertigo, spinning sensations, lightheadedness, wooziness, nausea and vomiting, disequilibrium or imbalance, sensitivity to moving visuals or moving surfaces, and some anxiety. And some people do develop hearing loss and ear fullness. Treatments for vestibular neuritis usually involves antiviral medications from your doctor, vestibular physical therapy to retrain your brain and your balance and your senses together again, and an audiologist if you have hearing loss. And don't be afraid to enlist help from a psychologist if you're having some psychological problems from this disorder, such as anxiety and depression. This book, called Ceiling Wings by Elizabeth Macklin, was written by a clinical psychotherapist about her experience with vestibular neuritis recovery. It's a really great read.